According to Healthy People 2020, a current objective is to decrease stroke-related deaths. My name is Christina Nelson, and I am a Brandman University DNP student. I'm here today to talk to you about reducing stroke-related deaths in a health campaign for Riverside County. From 1999 to 2007, stroke-related deaths decreased from 65 in 100,000 to 42 in 100,000 in Riverside County. Riverside County has a high premature death rate than that of the state of California, with those with poor or fair health making up 19% in Riverside County compared to 18% in California. Factors that affect stroke are as follows: adult smoking, adult obesity, physical inactivity, and access to primary care physicians. Adult smoking is 12% in Riverside County compared to 11% in California. Adult obesity is 26% compared to 23%. Physical inactivity is 21% compared to 18%. And access to primary care physicians is 1 in 2,380 compared to the state average of 1 in 1,280. Reducing blood pressure and smoking and promoting healthy diet and activity greatly diminishes the risk for stroke. Therefore, promotion of modifying these lifestyle choices can decrease premature death and risk for other cardiovascular events as well. Utilizing media sources, technology, and social networking allow for the DNP provider to educate large portions of the community and appeal to them in a variety of methods. The importance of educating as much of the population as possible contributes to the ability to engage in health promotion and lifestyle change. The results from the Healthy People 2010 campaign already showed significant improvement in the health population. Our duty to our patients is to continue these modifiable lifestyle changes that contribute to stroke and premature death. The health belief model is a person's belief in a personal threat of illness, together with the belief in effectiveness of the recommended health plan, along with the prediction of the ability to adopt behavior. There are 6 components to this model that need to be adapted to attain change in lifestyle behaviors. The completion of these 6 components can contribute to the reduction of stroke-related deaths if applied to modifiable risk factors of stroke. They are: perceived susceptibility, which is the accurate perception of one's own risk of acquiring the illness. Perceived severity, the person's feeling towards the seriousness of disease or illness. Perceived benefit, when to take action if the person feels they will have illness and there is serious consequence to not treating the illness. Perceived barriers, the person's feelings on the obstacles one must take to overcome the illness. This is the time to offer incentives and educate to overcome misbelief. The cue to action. This stage needs a stimulus to promote the change in behavior. This includes how to change and also reminders to promote healthy lifestyle changes, and can come from internal cues such as chest pain, cardiac events, or shortness of breath, or external cues such as advice, advertisements, or education. Self-efficacy refers to how confident the person is in successfully performing the desired behavior. Providing feedback and demonstration of behavior often reinforces the positive change. Utilizing media, presentations, posters, and social media allows one to reach a larger sample of the population. Providing links to healthcare services and education for stroke prevention, including controlling blood pressure, cessation of smoking, and healthy lifestyle, allows the community to browse the educational material at their own leisure. In doing the projects throughout this term, I have been able to provide links to my projects for the Riverside County area to view. As I progress through my DNP program and become a provider, I will have even more access to educating the community and decreasing the provider-patient ratio that is rather large in my county compared to the state averages. Providing links through social media and YouTube will allow for the health messages to get across and the objective of reducing stroke-related deaths to become reality. I have provided a blog entry available at the following link that allows for interaction within the community. Networking with health-related fields, community centers, and other services will allow for this blog to be more visible in the county. This blog reviews the necessity of reducing blood pressure in a friendly, upbeat manner. The next project reviews the city of Corona, located in Riverside County, and the resources available from the city. This is important for people to get familiar with the help that is there for them, to enable them to make healthy decisions, as well as essential programs and clinics that offer free or reduced rates. Next, the poster board that I made was placed on Pinterest. This poster board highlights the relationship between cigarette smoking and stroke. This was a very personal assignment to me, as my stepmother recently had a stroke, and she and my father are heavy smokers. I took ideas from another poster and website picture from the Heart Foundation and personalized my poster to make it more personal and really gain the visual appeal from the reader. Because smokers have 4 times as many strokes as non-smokers, this is a huge modification that can be made to prevent strokes. Utilizing YouTube, Pinterest, Google Blogs, and other social media are part of many ways to educate and promote health awareness in the community. By providing these resources, I can aid in reducing stroke-related death in Riverside County. Thank you for reviewing my campaign. I really hope that you can find a way to help me promote reducing strokes in Riverside County.